Okay, so today this will be lab 1. We're going to be talking about hand hygiene, patient positioning, and patient safety. So the first thing we'll talk about is the hand washing techniques, and the donning of gloves and applying hand sanitizer. Obviously now hand washing has become paramount with the COVID-19 running around, so this lecture will be more important than ever. Okay, so another alternative to hand washing would be your hand sanitizer. Okay, the hospital has all of these outside of every single room. Typically the way you do this is, depending on how much comes out, 2 or 3 squirts. Nice little thing on there. Make sure and lather your hands completely. Okay, typically you want to wait for this to dry. Okay, or at least dry. I usually just will wave my hands like this, kind of get some air in between there. But same principle when you're hand washing. You want to make sure and get all your fingers underneath your nails, any of that stuff with the alcohol. Okay, after you use the hand sanitizer, you still want to wear gloves. Okay, so the problem is whenever you put hand sanitizer on, it makes gloves a little bit more difficult to put on. But after a couple times of doing it in your career, no problem. So, okay, so donning gloves, very simple. Open them up. This isn't really a sterile process, but you are protecting yourself from the patient and the environment around you. So, typically, the most important thing about hand sanitizer is most hospitals only allow you to do it, I think it's between 3 and 5 patients. After that, you need to go wash your hands, because now this stuff starts to build up and it becomes less effective. Now you have all these germs sticking to your hands over time, so then you'd want to go and thoroughly wash your hands. Okay, so this isn't a fail-proof, but you do want to definitely wash your hands in between. Okay, like I said, every 3 to 5 patients is typically the rule.
Continuing on with lab number 1, we're going to be talking about hand washing and the proper way of hand washing. Okay, now with COVID-19, hand washing is going to be even more important, and we'll probably be washing much longer than normally prescribed, between 15 and 20 seconds. We'll probably be washing up to 30 seconds. So what you want to do first of all is, before you wash, you're going to make sure that you're at a distance between the sink. You do not want to be leaning over, touching the sink and getting your clothes dirty. Your hands, you want to make sure you have any watches, bracelets, any kind of jewelry on, even your ring, which could be an area for contamination or germs to deposit, especially female wedding bands or anything like that. It'll have different areas that could happen. So you can put that away. So basically, you have nothing in your hands. What you want to do is turn on the warm water. Get warm water. Adjust the temperature in both sides. Okay. So we got warm water. You want to apply ample amounts of soap. Okay. Ample amount. Then you're going to kind of just circle it around. Add more soap if you need. You want to wet your hands all the way up to your wrist area, right above the wrist area on both sides. Rub really good, and then with your hands, you're going to generally go about 15 to 20 seconds. Singing happy birthday or something like that would be good. You want to wash between your fingers. Okay, both hands. Water still running. Your cuticles, each finger, you want to clean each area there, each cuticle. Okay, on both hands. Then what you want to do is underneath the fingernail. Ideally, you should try to get underneath the fingernails. Okay. Both hands. And I'll tell you right now, you're probably not going to be doing this in real life at the hospital, but this is the proper technique of doing it. Then what you're going to do, you're going to go ahead and rinse with the water coming down from the upper part of your arm down to your fingertips and down the drain. Okay, as opposed to rubbing like this, all the dirty soap is going to just circulate around in your hand. So you're going to rinse. Try not to touch any part of the sink. Okay. And then the other hand. Okay. So now that you're completely rinsed off, you're going to get a clean towel. And then ideally you want to wipe downward. Okay. Get as much paper as you need to dry off your hand. And then you want to get one clean towel. You're going to go ahead and turn that water off with the clean towel. Okay. If you need to wipe the area around the sink, do so. Okay. And then you're pretty much done there.
So this is the Fowler's position. The head of the bed is typically at a 90-degree angle. For most patients, this is a little bit too high, but in certain situations, like if you were to give a small volume nebulizer, you'd want to make sure that your bed is in the high Fowler's position or the Fowler's position, and you'll learn about small volume nebulizers later in this term. Okay, this position right here that you see, this is semi-Fowler's. This is your most common position that you'll see in your spontaneously breathing patient as well as your intubated patient. Typically, like I said, this will be the most common position you'll see, and this is called semi-Fowler's. Okay, so this will be your Trendelenburg position. This would be a special circumstance position. Your most commonly, this would be for patients with low blood pressure issues, or they're hemodynamically unstable. So what this position essentially would do is it would pull blood from your lower extremities down closer to your heart. Okay, so to keep that blood pressure up or any other hemodynamic instabilities you may have. Okay, so this position is another specialty position. This would be reverse Trendelenburg. Okay, so if you notice here, the head is up and the feet are down. With your Trendelenburg position, your head is down and your feet are up. This position, again, would be a specialty position. If you had a patient with increased cranial pressures or ICP, you would want to put your feet down. So then what this is doing is the opposite effect. It's going to pull blood away from the head and reduce swelling of any cranial tissue. Okay, so again, this would be another specialty position. One other thing I want to make note of, since we're in this last position here, is typically this would be called your supine position right here. Okay, so basically your bed is against the wall, or your back is against the bed, excuse me. Okay, this would be your supine position, which is the most common. In some other special circumstances, if you're having trouble oxygenating patients, sometimes they might put them in a prone position. Obviously your head would be turned, okay, but then the chest would be to the bed and your back would be in the air. This is a prone position, okay, and then this would be your supine position, okay. So just to make note of that, prone is a very special circumstance for certain situations. Typically, as respiratory therapists, you may have the opportunity to put a patient in a prone position for oxygenation purposes if they are mechanically ventilated and having trouble oxygenating. Okay, so this will be patient turning and patient positioning. Okay, so typically this would be an assistance to the nurse, but you need to know how to do this. Like I said, this is teamwork. You know, we're in the healthcare system, so you want to make sure to work together. Okay. So whenever you're turning a patient, you'll have the patient put his arms over his chest like so. You'll bend this knee, okay? You'll bend this knee over, okay? And then grab him by his hip and his shoulder and turn him, okay? While you're doing this, you want to make sure you're as close to the bed as possible so the patient, essentially, you're not losing the patient off the bed, okay? So then, as you can see here, what we're doing is we're taking the sheet, rolling it under, okay, the patient, because this would be typically what you do during a bedding change or a linen change for the patient. Also, you could do this if you had to tuck a pillow under for the patient if they wanted the patient positioned on a specific side. Okay, like so, we would tuck it under like so. Okay. So now that we have the sheet over on that side, we'll have them lay flat again.
Okay.
Okay.
Just raise your leg up here for me, sir. Turn them over.
Okay. And then I will unroll the other half of the sheet here. Okay. Then we'll put the patient back flat, okay? Another thing you commonly might do, I'm going to lift your head up here for a second, is you might have to pull the patient up in bed, because after a couple hours sitting in bed, you may just start sliding down. The nurses may ask you for help with this. So The most important thing with all of these procedures is you want to protect your back. Okay, that's the number one injury in healthcare, and you always want to make sure to protect your back. Okay, so how you would do this here is you'd always grab somebody. You can grab 2 people, 4 people, depending on how big the patient is and how many people are around. So typically, what you'll do is you're going to put the bed to a height that is good enough for you to be able to pick them up. Okay.
Okay. There we go.
So then, what you're going to do is you're going to grab the 2 ends of the sheet. Okay. Make sure it's taut on both sides. Okay, and then on the count of 1, 2, 3, you're going to lift and pull up. So 1, 2, 3, lift and pull up. Okay, so that would be good enough there. Then we'd straighten out the bed sheet like so. Okay, and then we would say, "Sir, are you okay?" Lift your head. I'll put those pillows under there comfortably for you. Thank you very much. And always to make sure, put your bed rails up. Okay, patient safety. Okay, in addition to this, before you are actually doing any pulling or turning or anything, you always want to make sure there's any lines, okay, intubation tubes, any IV lines, all of them have enough room to move with you, okay? So those are some other precautions. In addition to that, you always want to make sure the bed is locked. If you try moving a patient on a bed that's moving, it'll move with you, okay? So those are some things you want to be aware of. In addition to that, you want to make sure if there's any wounds or any surgical sites while you're turning, okay? And again, sometimes you can ask the patient this if you don't know, but you want to be, these are some precautions you'd want to be aware of before you start moving a patient. And again, this is something you're going to assist the nurse with, and usually they will let you know the situation at hand.